Prior to measuring blood pressure, the subject must remain sitting for at least 5 minutes and refrain from smoking cigarettes and consuming caffeine at least 30 minutes before the assessment. Measurements must be taken on the bare arm. In order to measure resting blood pressure, a blood cuff, manometer, and stethoscope are required. The subject must be seated straight with their back against the chair, arms extended facing upward to expose their brachial artery, and their feet flat on the ground. Make sure to check for proper cuff size. The cuff should not be too large or too small. 2 fingers should fit in between the subject's arm and cuff. Make sure to identify the artery mark on the cuff and align it with the subject's brachial artery. After this, wrap the cuff around the subject's upper arm. Prolings should be facing outward to listen well. Palpate the subject's arm to identify the brachial artery's pulse. Place the chest piece over the brachial artery and inflate the cuff pressure to 200 millimeters of mercury. After reaching 200 millimeters of mercury, slowly release the pressure at a rate of 2 to 5 millimeters of mercury. Carefully listen for the first sound, which is the systolic reading, and listen for the final sound, which is the diastolic reading. The subject's resting blood pressure was 110/80, which is considered to be normal. It is debatable, but it is recommended to wait between 3 to 5 minutes before reassessing blood pressure. The following table demonstrates the resting blood pressure measurements for individuals older than 18 years old. Individuals should not be taking any hypertensive medication or be acutely ill.